All right, so today we've got a stack of info on tetracyclines. Articles, research, even some notes from Dr. Khalid Hassan. He's a professor who's really dived deep into these antibiotics, and trust me, this deep dive is fascinating. We're going to try to extract the most crucial knowledge, and I think you'll find some surprising insights along the way. Tetracyclines are more than just your average antibiotic. They pop up in some pretty unexpected places.
Yeah, they're actually a key weapon against Lyme disease.
Lyme disease, I always kind of associated tetracyclines with treating acne. How do they work against something that's spread by a tick bite?
Well, Lyme disease is caused by the bacterium Borrelia burgdorferi, and tetracyclines are effective against a surprisingly wide range of bacteria.
Okay, so let's rewind a bit. What exactly are tetracyclines and how do they work?
So tetracyclines are a group of antibiotics that work by inhibiting bacterial protein synthesis. They bind to the 30s subunit of bacterial ribosomes. And by doing that, they block the attachment of amino-acid tRNA, which is needed to create proteins. This prevents protein synthesis, which essentially halts bacterial growth. We call this bacteriostatic action.
So they don't necessarily kill the bacteria outright, but they stop them from multiplying and causing more harm. I've heard the term broad spectrum used to describe them. What does that mean?
That's a key point. Broad spectrum means they can combat a wide array of bacteria, gram-positive, gram-negative, even those tricky atypical pathogens.
This broad spectrum action seems like it would make tetracyclines incredibly versatile, but it also makes me wonder about, disrupting the body's natural bacterial balance.
That's a great point. It is a bit of a double-edged sword. While this versatility allows them to be used for conditions like acne, cholera, Rocky Mountain spotted fever, and Lyme disease, it also means they can have some unintended consequences. We'll get into the specifics of that a bit later, but for now, let's explore just how many conditions tetracyclines can treat. It really is quite remarkable.
I am all ears. What else can they treat?
Well, we also see them used for certain types of pneumonia, urinary tract infections, and sexually transmitted infections, particularly chlamydia.
So from skin infections to serious systemic infections, tetracyclines seem to have quite a range.
And we can't forget their role in gut health. They're often part of a multi-drug protocol to eradicate H. pylori, a bacterium implicated in peptic ulcers. There's even one tetracycline, demeclocycline, that's used to treat a specific type of tumor. That secretes excessive antidiuretic hormone.
I was surprised to learn that tetracyclines can be used for ulcers. How does that even work?
It's not that the tetracycline itself directly treats the ulcer. H. pylori bacteria actually play a major role in the development of ulcers. Tetracyclines, in combination with other medications, help to eradicate these bacteria, allowing the ulcer to heal.
That makes sense. So we've established that tetracyclines are multi-talented, but how do they actually move through the body? Where do they accumulate?
Tetracyclines have this remarkable ability to travel throughout the body and accumulate in various organs: the liver, kidneys, spleen, and even the skin. This is particularly important for their effectiveness in treating certain conditions.
So that explains why they're so good for acne. The medication is right there where it's needed.
Precisely. That high concentration in the skin makes them particularly effective against those acne-causing bacteria. But there's a catch. They also bind to calcified tissues, like teeth and bones.
Right, and that's why I know there's that warning against giving them to young children.
Yes, their use is generally restricted in children under 8 years old because of the potential for tooth discoloration and the impact on bone growth.
But wouldn't avoiding tetracyclines entirely in children limit treatment options for, serious infections?
That's a valid concern. It's a balancing act. The risk of tooth discoloration and potential impact on bone growth is a serious consideration. In those cases, the potential benefits must be carefully weighed against the risks.
Okay, so besides teeth and bones, are there any other places tetracyclines tend to accumulate?
For the most part, they don't cross the blood-brain barrier very effectively. However, minocycline stands out. It can cross this barrier and reach therapeutic concentrations in the brain. This makes it particularly useful for infections of the central nervous system, where other tetracyclines might not be as effective.
That's interesting. It sounds like minocycline is the outlier in the tetracycline family. Now, before we get too carried away praising their versatility, let's talk about potential side effects. No medication is perfect, and it seems like tetracyclines could have some downsides, given how they work and where they accumulate.
You're absolutely right. Tetracyclines are powerful medications. And with that power comes the potential for adverse effects.
So what are we looking at here? What kind of side effects can they cause?
Well, some are common and relatively mild, like gastrointestinal issues, upset stomach, nausea, things like that. But there are also more serious concerns. We already talked about the effects on teeth and bones in children. which is why their use is restricted in younger age groups.
Right. What about other side effects?
Another one is photosensitivity, which basically means an increased risk of sunburn. If you're taking tetracyclines, you'll want to be extra diligent about sun protection.
Does this mean that patients need to be extra careful about their diet while on tetracyclines? Are there other surprising interactions we should be aware of?
Yes, absolutely. The absorption of tetracyclines can be significantly affected by certain foods and medications. Dairy products, calcium supplements, and antacids can bind to tetracyclines and reduce their absorption. That's why it's crucial to take them on an empty stomach with a full glass of water.
Got it. No milk chasers with these antibiotics. What about more serious side effects, like the ones we talked about with accumulation in the liver and kidneys?
There is a potential for liver and kidney toxicity, particularly with high doses or expired medications. This is why it is absolutely essential to follow your doctor's instructions regarding dosage and to check expiration dates carefully.
So minocycline is different, right? Are there specific side effects associated with that one?
You're right to bring that up. Since minocycline can cross the blood-brain barrier, there's a risk of vestibular toxicity, which can cause dizziness and problems with balance.
Are there any other serious, although maybe less common side effects we should be aware of?
Well, there's a rare but serious side effect called pseudotumor cerebri. This is a condition where pressure inside the skull increases, mimicking the symptoms of a brain tumor. Additionally, because tetracyclines are broad-spectrum antibiotics, they can disrupt the balance of normal bacteria in the body. This can sometimes lead to overgrowth of other organisms like Candida or C. difficile, which can cause their own set of problems. We call this a superinfection.
So it seems like tetracyclines are a bit of a double-edged sword, incredibly useful in treating a wide range of conditions, but with the potential for some serious side effects. Given these risks, are there situations where tetracyclines are entirely off limits?
Yes, there are certain situations where using tetracyclines is simply not advisable. We call these contraindications.
That's right. And we were just starting to touch on those situations where tetracyclines are a definite no-go.
Right, patients. Let's dive into those. When would a doctor absolutely advise against prescribing a tetracycline?
One of the major contraindications is renal impairment.
Meaning problems with kidney function. That makes sense considering we talked about the potential for kidney toxicity earlier.
Exactly. Most tetracyclines are not recommended for patients with kidney issues as they can worsen kidney function. However, there's an exception to this rule. Doxycycline.
Doxycycline seems to be the exception to a lot of these rules. Why is that? Well, doxycycline is metabolized and excreted differently than other tetracyclines. This difference makes it a safer option for individuals with compromised kidney function.
Good to know there's a safe option for those patients. What other situations would make tetracyclines a bad idea?
Pregnancy and breastfeeding are two very important ones.
That makes sense considering what we discussed about their ability to accumulate in different parts of the body. They can cross the placenta and potentially harm the developing fetus, right?
Precisely. And they can also be present in breast milk, posing a risk to the nursing infant.
So we've got renal impairment, pregnancy, and breastfeeding. Any other situations where tetracyclines are contraindicated?
The last major one, which we discussed earlier, is in children under 8 years of age.
Right, because of the risk of tooth discoloration and the potential impact on bone development. I know there are always exceptions, but in general, it seems like the risks outweigh the benefits in this age group.
You've hit the nail on the head. It's all about carefully weighing those risks and benefits. In young children whose bones and teeth are still developing, alternative treatment options might be a better choice.
It's a relief to know that doctors carefully consider these factors when making treatment decisions. Are there any other less common contraindications related to tetracyclines?
Those are the big ones. But as with any medication, there might be other specific situations where a doctor might advise against using tetracyclines. This could be based on a patient's individual medical history, allergies, or other medications they are taking.
It sounds like open communication between doctor and patient is essential to ensure the safest and most effective treatment plan. Now, I want to shift gears a bit and talk about dosage and administration. You mentioned that there are a few different types of tetracyclines. Does the dosage vary depending on the specific tetracycline being used?
It absolutely does. Dosage depends not only on the specific tetracycline, but also the severity of the infection and the patient's individual characteristics.
So it's not a one-size-fits-all situation?
Not at all. There are different dosages and routes of administration, including oral capsules and tablets, and even intravenous injections.
It sounds like there's a lot of flexibility depending on the patient's needs and the type of infection being treated. What about the different types of tetracyclines themselves? Do they have different properties?
Yes, they do. One key difference is their half-life, which is the time it takes for the concentration of the drug in the body to reduce by half. Tetracycline itself, the original drug in this class, has a shorter half-life and requires multiple doses per day.
So patients taking tetracycline might have a more complicated medication schedule.
That's right. However, other tetracyclines like doxycycline, minocycline, and oxytetracycline are longer acting and can generally be given once daily.
That's good news for patients. Taking medication once a day is much easier to manage than multiple doses throughout the day. Now, are there any other important considerations regarding how tetracyclines are taken?
Yes, a crucial point to highlight is how the absorption of tetracyclines can be significantly impacted by what you take them with.
You mean like food and other medications?
Exactly. Certain substances can bind to tetracyclines in the digestive system and reduce their absorption, making them less effective.
So which foods and medications should patients be aware of?
Dairy products, calcium supplements, and antacids are the main culprits. It's very important to take tetracyclines on an empty stomach with a full glass of water to ensure proper absorption.
So to clarify, if someone takes their doxycycline with a glass of milk, it might not be as effective.
That's right. The calcium in milk can interfere with the absorption of the antibiotic, reducing its ability to fight the infection.
I can see how this kind of information could easily get lost or misunderstood. It seems like clear communication from healthcare providers is essential to make sure patients take these medications correctly.
I completely agree. Patient education is a critical part of ensuring medication safety and effectiveness. And we've covered a lot of ground. The mechanisms, the versatility of tetracyclines in treating various conditions, their potential downsides, and when they're a definite no-go.
We've explored
Their potential downsides, and when they're a definite no-go.
We've explored all the individual pieces of the puzzle. Now I'm interested in connecting those pieces to the bigger picture. What are the implications of all this?
That's a great segue. We've talked about how tetracyclines work by inhibiting protein synthesis in bacteria. But bacteria are incredibly adaptable and can develop ways to resist this mechanism.
You're talking about antibiotic resistance. I know this is a huge problem in medicine today. How does it relate to tetracyclines?
It's a very real and pressing concern. With the widespread use of antibiotics, including tetracyclines, we're seeing more and more cases of resistance. Bacteria, through various mechanisms, can evolve to overcome the effects of these drugs, rendering them ineffective.
So are you saying that tetracyclines are becoming less useful in treating infections?
It's a real possibility, and it's a trend we're seeing with many different types of antibiotics. We need to be mindful of how we use these powerful drugs to ensure we're not contributing to the problem of resistance.
That makes sense. It's like a delicate balance. We need to use antibiotics to fight infections, but we also need to protect their effectiveness for the future. So, what can be done? Is there hope for the future of tetracyclines in the face of this growing resistance?
There's definitely hope. Scientists around the world are working tirelessly to address this challenge.
That's reassuring to hear. So what are some of the strategies being explored? What's being done to ensure these medications remain effective?
One promising approach is to develop new antibiotics that work in completely different ways. This means targeting different essential processes within bacterial cells, processes that haven't been exploited by existing antibiotics.
So if bacteria develop resistance to tetracyclines, we'll have other options to fight those infections. It's like having a backup plan.
Exactly. Researchers are focusing on novel targets within bacterial cells, hoping to discover new mechanisms of action that bacteria haven't yet developed resistance to.
What about using existing antibiotics differently? Could that help combat resistance?
That's another area of active research. Scientists are exploring the potential of combining existing antibiotics in strategic ways. Sometimes using 2 or more antibiotics together can have a synergistic effect, meaning the combination is more effective than using the drugs individually. This can be helpful even if the bacteria have developed resistance to one of the antibiotics in the combination.
That's fascinating. It's like a multi-pronged attack overwhelming the bacteria from different angles. I imagine there are other strategies beyond developing new drugs or new combinations.
You're absolutely right. There's a growing emphasis on what we call antibiotic stewardship.
Stewardship, what does that involve?
It's all about using antibiotics wisely, and only when they are truly necessary. Overprescribing antibiotics is a major contributor to the problem of resistance.
So making sure that antibiotics are used appropriately, and not for every minor illness. That makes sense.
Exactly, and when antibiotics are needed, it's crucial to ensure patients take the full course as prescribed. Not completing a full course of antibiotics can allow the more resistant bacteria to survive and multiply, further fueling the problem.
It sounds like both healthcare providers and patients have a role to play in responsible antibiotic use.
Yeah, absolutely. Education is a key component of antibiotic stewardship. Educating healthcare providers on best practices for prescribing antibiotics and educating the public about the importance of appropriate antibiotic use are both essential.
Are there any completely new approaches being investigated? Anything that moves away from traditional antibiotics entirely?
There's some very exciting developments in that area. One that holds a lot of promise is phage therapy.
Phage therapy. I'm not familiar with that one.
Bacteriophages are viruses that infect and kill bacteria. They're natural predators of bacteria.
Phage therapy. I'm not familiar with that one.
Bacteriophages are viruses that infect and kill bacteria. They're natural predators of bacteria and are being investigated for their potential as a targeted therapy for bacterial infections.
So it's like using nature's own weapons to fight bacteria. Are phages able to keep up with bacteria, as bacteria evolve to become resistant?
That's one of the fascinating aspects of phage therapy. Phages can co-evolve with bacteria, adapting to changes in bacterial resistance mechanisms.
That's incredible. It seems like a very promising approach. What about improving our existing antibiotics? Are there ways to make them more effective against resistant bacteria?
There's ongoing research in that area as well. Scientists are exploring ways to modify the structure of existing antibiotics, making them more potent or better able to overcome resistance mechanisms.
So it's like giving those antibiotics an upgrade.
That's a great way to put it. The field of antibiotic research is incredibly dynamic, and there's a lot of hope that we can stay ahead of the resistance curve.
This deep dive into tetracyclines has been quite an eye-opener. We've gone from the microscopic level of how these drugs work to the global challenge of antibiotic resistance.
It's been a pleasure exploring these fascinating topics with you, and I hope our listeners come away with a deeper understanding and appreciation for these remarkable medications.
Well, you've officially completed a deep dive into the world of tetracyclines. We covered their mechanisms, their incredible versatility in treating a range of conditions, their potential downsides, and the ongoing battle against antibiotic resistance. But this is just the beginning of your tetracycline journey. There's a whole world of research and clinical applications out there.
And remember, knowledge comes with responsibility. Let's all do our part to use antibiotics wisely and preserve their effectiveness for generations to come.